I am Randy Easton, the board chair of the Community Cancer Center of Iowa, and I'm pleased to announce that Helen Nassif is once again making a tremendous investment in the future of healthcare in Cedar Rapids. Ms. Nassif's gift comes at an important time for the Community Cancer Center of Iowa as we work to redesign cancer care while the new medical pavilion is under construction. You know, an undertaking of this nature has many milestones, and the announcement of this generous gift is a very fitting complement to the addition of the new intraoperative radiation oncology option that for our community, that we were able to announce just recently. You know, we started this journey to create a true community cancer center over 3 years ago, and we issued at that time an invitation to the entire community to help us develop a model of care that puts the patient's needs at the heart of the experience. Statistically, as probably we all know, cancer touches 1 out of 2 men and 1 out of 3 women. And for that reason, we welcomed and encouraged all members of the healthcare community to join together and be part of this effort. I believe it is the spirit of that collaboration that had a significant influence on Helen's decision to bestow her generosity on our program. As many of us know, Helen Nassif has been extremely generous to the city of Cedar Rapids. Her name appears on many prominent buildings in our community. She's a former Cedar Rapids resident, now lives in Rockville, Maryland. As many of you probably know, Helen grew up in a house on B Avenue, very close to here, attended Coe College, went to law school at George Washington Law School in Washington, D.C., worked as a lawyer for 32 years with the U.S. government and was the first woman named to a bank board in Washington, D.C., and thereafter served on many other bank boards, plus other large corporations. Helen has also been very actively involved in commercial real estate and as a builder and a developer. So it is with great pleasure and much gratitude that I announce today that Helen Nassif has donated $1 million to the Community Cancer Center of Iowa. Ms. Nassif's gift will name the center as the Helen G. Nassif Community Cancer Center. Helen couldn't be with us today, but she wanted to share a few comments in her own words. I believe in the collaborative spirit, she said, between physicians and other providers working together for the patient. And it is my hope that this center can someday be a platform for all providers in Cedar Rapids to work together. What a great hope, and one that we all share. And although Ms. Nassif can't be with us today, we are honored to have several of her family members here, and in particular, her great nephew, Mr. Kent Lair, has additional comments to make on her behalf. Kent.
Good morning. First, I just want to thank you all for being here to share this special announcement with us. On behalf of my Aunt Helen Nassif and the Nassif Foundation, I want to emphasize that this gift is about community. And it's about the continued provision of excellent community-based cancer care right here in Cedar Rapids. My aunt has great pride for Cedar Rapids, and she has shown that by continuing to give back to this area. As her great nephew, I also have a lot of pride that she and the leaders of the Community Cancer Center continue to invest in delivering the highest quality care right here in Cedar Rapids so that the people of this community can continue to receive patient-centered care where it matters most to them, and that's right here at home. Thank you.
Thank you, Kent, for participating today. Now I'd like to bring Dr. Jeffrey Krivit to the podium. Dr. Krivit is a surgeon and vice president of Physicians Clinic of Iowa, is chair of PCI's ENT practice, and a physician partner with the Community Cancer Center of Iowa. Dr. Krivit.
Thank you, Randy. We are touched and deeply grateful to Helen Nassif for this amazing gift. This gift will help the center deliver high-quality, patient-centered care and ensure Iowans will have convenient access to the most advanced cancer care available anywhere. This cancer center isn't about a building. It's about delivering coordinated patient care where physicians work together for the good of the patient. The Helen G. Nassif Community Cancer Center is fully operational today and housed in the Medical Office Plaza on A Avenue until space in the PCI Medical Pavilion is complete in 2013. We are caring for patients today. The Community Cancer Center is open now. The Helen G. Nassif Community Cancer Center began after a group of local cancer experts from multiple specialties identified a need to improve cancer care of cancer patients through better coordination among healthcare providers. More than 200 doctors, including Physicians Clinic of Iowa, St. Luke's Hospital, and many others, make up the medical team for the Helen G. Nassif Community Cancer Center, which positions us as the only physician-led, patient-centered cancer center where we are all working together for the patient's well-being. Patients benefit from the experience and the expertise of the center's teams of doctors, nurses, and support staff working together to develop individualized and comprehensive plans for each patient that may include surgery, chemotherapy, or a combination of treatments. The healthcare team is committed to meeting the needs and expectations of patients by offering comprehensive diagnosis, treatment, psychological support, supportive care, long-term and follow-up care. Putting patients first and having physicians work together is what this cancer center is all about. I'd like to introduce a cancer patient of the Community Cancer Center, Mrs. Jane Stevens, who will tell us how important this coordinated care is to her treatment. Thank you.
Well, thank you for inviting me today to share in this wonderful announcement of Ms. Nassif's generosity. I was asked to share my experience as a cancer survivor and a patient who has experienced patient-centered, physician-led medicine at the Community Cancer Center and what this means to me and my family. On May 21st of last year, I heard the words invasive ductal carcinoma over the phone. I was on my way out of town with my husband to work at a convention, and I asked my doctor to tell me the results of my biopsy over the phone rather than wait several days until I was home again. Hearing that I had breast cancer was frightening enough, but the word invasive was terrifying. My first thoughts and words were that of disbelief and shock. Was I going to die? How did this happen? What did I do wrong? Of course, there were many tears. Well, life is a journey, and mine now included one I hadn't planned on making. The cancer journey is a difficult one, and of course, a different one for everyone afflicted with this disease. For me, it was filled with many emotions: disbelief, confusion, guilt, anger, fear, depression, exhaustion, uncertainty. Like the process of grieving, however, you eventually make your way through your different emotions, and they hopefully disappear with time. The wonderful thing is, though, is that you don't have to do it alone. The Community Cancer Center offers an extensive array of supportive services. I have taken advantage of many of them and continue to. I have learned so much from all the different programs I have participated in, and am so grateful to all the medical providers and staff that I have come into contact with in this process. I believe the new Helen G. Nassif Community Cancer Center of Iowa will make the cancer journey easier and much more convenient for the patient. It will no longer be necessary to go from one location to another different location. The patient will achieve a sense of familiarity and comfort as they make their cancer journey, from diagnosis to education, treatment, and recovery, all in one facility. The physician's communications will also be made easier, allowing coordinated care amongst the medical providers. The bringing together of staff and resources will result in continuity, leading to better care. So, Mr. Lear, please thank your great aunt, Ms. Nassif, on behalf of one grateful survivor, for all she does and has done for our community. Thank you.
Wow, she's good. Jane, thank you. Too often in healthcare, I think we find that people speak of models of care or protocols of treatment or patient navigation, but those are really just terms. Much more importantly, however, it's people like Jane that remind us why we developed this cancer center in the first place. She's the real flesh and blood type example of what this is all about. Thank you. And you really work good. And now I'd like to invite Dr. John Vandersee to come to the podium for a few remarks. Dr. Vandersee is a plastic and reconstructive surgeon and a physician partner for the Community Cancer Center. Doctor?
Thank you, Ms. Stevens, for sharing your experiences with how this new model of care is going to make a difference in your life as well as in the lives of all of our cancer patients. The goal of the Nassif Community Cancer Center will be to improve the care of the cancer patients through better coordination and collaboration amongst the healthcare providers. The support of a true community cancer center has continued because of the efforts and determination of many medical providers here in Cedar Rapids. With Ms. Nassif's extraordinary gift, we will continue to offer our community a state-of-the-art cancer center where collaboration among physicians is going to drive a patient-centered approach to their care. Thank you, Ms. Nassif, for believing in changing the healthcare model that we have here today. It will enable a better tomorrow for Cedar Rapids and the patients we care for. Thank you for coming today and sharing our progress and news.
Thank you, Doctor. I'd like to call Ted Townsend, please, to the podium for a little perspective on from the hospital. Ted, CEO of St. Luke's. Ted.
Thank you, Randy. I think I just want to add my thanks to everyone else here today. Ms. Nassif is an incredible lady. I've had the good fortune to know her for a number of years, and this truly is just an extension of her commitment to our community, but it's exactly the kind of extension that benefits so many people that she would want to be doing. I also want to thank some people that are making it real. I want to thank the physicians who are here today and all the other hundreds of physicians in this community who've committed to say they want to cooperate with this center. They understand that it takes putting the patient at the center and that they've got to change some of how they do things to better coordinate the care and to continue to put that patient at the center of what they do. I want to thank people like Kim Ivester, who's the executive director of this, and Michelle and Angie and all the folks who've been working on the operations to try to make sure that not only do we design a good facility that will be able to facilitate this kind of coordination of care, but that we're actually working on the protocols and the tough work of actually sitting down with people and trying to refigure how do we actually deliver this care differently with that patient at the center. And then I also want to thank, finally, the St. Luke's Board of Trustees, who I think were instrumental in getting us here as well, because they had to subordinate their goal of a St. Luke's Cancer Center that they had in their eyes several years ago. And they bought into the idea of a community cancer center when that idea was broached to us by physicians in this community 2.5 years ago. And when we weren't able to get everyone in the community to stick with that vision, that board basically said, we still believe in that concept. We still believe that it would be better to collaborate with other providers in the community versus going back to our original plan of doing something separate for St. Luke's. So I want to thank Ms. Nassif for believing in us, believing in this concept. I want to thank the people who are making it real, and I want to thank the St. Luke's board for subordinating their individual goals to the betterment of the community. I think everyone is richer for that, and I think the patients will benefit every day. Thank you.
Thank you, Ted. So in closing, I guess I would like to add and once again publicly thank Helen Nassif for her generosity and for joining us in believing we can continue to change healthcare for a better tomorrow for Cedar Rapids and the patients we care for. And I will use her own words to restate the goal of our cancer center. It is my hope, Helen said, that this center can someday be a platform for all providers in Cedar Rapids to work together. Wouldn't that be a wonderful goal? Thank you all for coming and sharing our progress. This is truly a great day for our community. Thank you very much.